Hi, my name's Ted O'Connell. This is part 1 of the ear, nose, and throat surgery chapter of USMLE Step 2 Secrets. Before we get started, please take a look at medicalschoolvideos.com for additional videos and send us your thoughts and ideas at step2secrets@gmail.com. Let's get started with this video. What is the most common cause of lower motor neuron facial nerve paralysis? What are the classic symptoms? The most common cause is Bell palsy. Look for sudden unilateral onset, usually after an upper respiratory infection. The cause is thought to be a reactivation of latent herpes simplex 1 infection in most cases. Patients may have hyperacusis, in which everything sounds loud because the stapedius muscle in the ear is paralyzed. In severe cases, patients may be unable to close the affected eye. If so, use drops to keep the eye moist. Most cases resolve spontaneously in about 1 month, although some have permanent sequelae. Oral prednisone and antiviral treatment for the herpes, such as valacyclovir or acyclovir, may improve outcomes and lessen the duration of symptoms. What are the other causes of lower motor neuron facial nerve paralysis? Herpes infection, also known as Ramsay-Hunt syndrome, which commonly involves the 8th nerve. Look for vesicles on the pinna and inside the ear. Encephalitis or meningitis may be present. Lyme disease, which is one of the most common causes of bilateral facial nerve palsy. Stroke, middle ear or mastoid infection. Meningitis, a temporal bone fracture. Look for battle sign and or bleeding from the ear. And tumor, classically an acoustic neuroma of the cerebellopontine angle. Order a CT scan or MRI of the head if the cause is not apparent or if the history or physical exam raises suspicion, especially in the presence of additional neurologic signs. What are the common causes of hearing loss? The most common cause is aging, also known as presbyacusis. Prescribe a hearing aid if needed. The history, though, may suggest other causes, such as prolonged or intense exposure to loud noise, such as work-related noise issues, congenital torch infection, and just a reminder that torch is toxoplasmosis, other infection, rubella, cytomegalovirus, and herpes virus. Next, Meniere's disease, which is accompanied by severe vertigo, tinnitus, nausea, and vomiting. Treat acute episodes with benzodiazepines, anticholinergics such as scopolamine, and antihistamines such as meclizine or dimenhydrinate. Diuretics are often used for ongoing treatment, and surgery may be used for refractory cases. Other causes of hearing loss: drugs such as aminoglycosides, aspirin, quinine, loop diuretics, and cisplatin. Tumors, classically an acoustic neuroma. Labyrinthitis, which may be viral or follow or extend from meningitis or otitis media. And then miscellaneous causes, such as diabetes, hypothyroidism, multiple sclerosis, sarcoidosis, and pseudotumor cerebri. What is the usual cause of sudden deafness? Sudden sensorineural hearing loss involves acute, unexplained hearing loss that is usually unilateral and occurs over hours, typically less than 72 hours. More than 90% of patients with sudden sensorineural hearing loss report tinnitus. Most cases are idiopathic, but have been postulated to be caused by viral causes, microvascular events, or autoimmune causes. The physical examination is unremarkable. MRI is indicated to rule out etiologies such as acoustic neuroma, multiple sclerosis, or vascular insufficiency. Glucocorticoids, administered orally or by intratympanic injection, are considered first-line therapy. Antiviral agents are sometimes used, although there is not much evidence to support their use. 2/3 of patients recover, although the resolution is often not complete. Among those who recover, hearing usually returns within 2 weeks. What is the most common cause of acquired hearing loss in children? Bacterial meningitis. All children should receive formal hearing testing after a bout of meningitis. What are the common causes of vertigo? Vertigo can result from the same eighth cranial nerve lesions that cause hearing loss, such as Meniere disease, tumor, infection, and multiple sclerosis. Another common cause is benign positional vertigo, which is induced by certain head positions, may be accompanied by nystagmus, and is not associated with hearing loss. This condition often resolves spontaneously. No treatment is required. The Epley maneuver, or modified Epley maneuver, may help with resolution of the symptoms. How is a deviated nasal septum treated in patients with recurrent sinusitis? The answer is surgical correction. What are the three common causes of rhinitis? These are viral, allergic, and bacterial. How do you recognize and treat viral rhinitis? Viral rhinitis, or the common cold, may occur because of rhinovirus, the most common cause, influenza, parainfluenza, Coxsackie virus, adenovirus, respiratory syncytial virus, coronavirus, or echovirus. The treatment is symptomatic. Vasoconstrictors such as phenylephrine can be used for short-term symptom relief, but they may cause rebound congestion when discontinued. How do you recognize and treat allergic rhinitis? Allergic rhinitis is associated with seasonal flare-ups, boggy and bluish nasal turbinates, onset before 20 years of age, nasal polyps, sneezing, pruritus, conjunctivitis, wheezing or asthma, eczema, a positive family history of allergic rhinitis, eosinophils in the nasal mucus, and elevated serum immunoglobulin E. Skin tests may identify an allergen. Treat with avoidance of known antigens such as pollen. Antihistamines, nasal steroids, and/or cromolyn may be used for more severe symptoms. Desensitization is also an option. What causes bacterial rhinitis, and how is it treated? Group A streptococci, pneumococci, or staphylococci are the most common culprits. Look for coexisting sore throat, fever, and tonsillar exudate. Obtain streptococcal throat cultures and treat with antibiotics if appropriate. True or false? A neck mass is more likely to be benign in a child than in an adult. True. Remember the 75% rule. Roughly 75% of neck masses are benign in children, while 75% of neck masses are malignant in patients older than 40 years of age. What are the common causes of a neck mass? In children, watch for thyroglossal duct cysts, which have a midline location and elevate with tongue protrusion. Branchial cleft cysts, which are lateral in location and often become infected. Cystic hygromas, which are benign tumors, also known as lymphangioma, that is associated with Turner syndrome and treated with surgical resection. And cervical lymphadenitis. Cervical lymphadenitis is usually caused by streptococcal pharyngitis, Epstein-Barr virus, which is common in the second and third decades of life, cat scratch disease, or mycobacterial infection, also known as scrofula. In terms of malignancy in children, leukemia or lymphoma may present with cervical lymphadenopathy. In adults, suspect malignancy, either lymphadenopathy from a primary tumor such as lymphoma or metastatic neoplasm, which is usually a squamous cell carcinoma. The mass may also represent the tumor itself, especially in the case of thyroid cancer. That's the end of part 1 of the ear, nose, and throat chapter. Please join us in the next video for part 2 of ear, nose, and throat.